Hypopituitarism, Pheochromocytoma, and Growth Excess Hormones by Allison Keith and Scott. Hypopituitarism is a decreased secretion of one or more of the 8 hormones produced by the pituitary gland. It's also considered a rare disorder. These are the different hormones that are secreted by the pituitary gland. Each of the hormones do different things to affect the body in different ways. The causes of hypopituitarism, the most common cause is pituitary adenomas, which are tumors of the pituitary gland, brain surgery, head traumas, infections of the brain, radiation from chemotherapy, stroke, subarachnoid hemorrhages, and chronic pituitary inflammation are other causes. Signs and symptoms of hypopituitarism vary in the relation to the hormones that are missing or lack of. Some of these signs and symptoms may include loss of armpit or pubic hair, loss of body or facial hair, low blood pressure, shortness in height, slow growth in children, such as the photos down below, vision problems due to the head expanding quicker than the body can keep up with, weakness and weight loss. Diagnosing hypopituitarism can be done by presenting symptoms that are occurring physically. They can be checked out by X-rays, CT, and MRI scans, neurospecific gravity tests, and 3-type blood tests. One is the basal level, the dynamic test, and then GH growth hormone stimulation. Treatments for hypopituitarism include surgery to remove tumors, radiation to shrink the tumors, and then improve the symptoms via hormone replacement therapy. Pheochromocytoma is a benign tumor in the medulla-adrenal gland and accounts for 90% of all cases. It can occur anywhere where crossman cells reside, such as the heart, bladder, and kidneys. It can develop at any age, but mostly middle-aged adults from 30 to 40 years old. The adrenal gland produces excess catecholamines, which increases blood pressure and heart rate. Signs and symptoms of pheochromocytomas include excess catecholamines, which result in high blood pressure, rapid heart rate, forceful heartbeats, profound sweating, headaches, sudden onset, anxiety, and weight loss. Diagnosing a pheochromocytoma, the most accurate test is to test for metanephrine in the blood plasma. Other tests, which are not recommended, would be to gently press on the adrenal gland. Pheochromocytoma may release a burst of catecholamines at that point, which would immediately follow with signs and symptoms. Other tests to rule out would be differential diagnosing tests. The treatment for pheochromocytoma includes segmental resection, surgical procedures to remove part of an organ, gland, or tumor, calcium channel blockers, beta blockers, and a consistent follow-up care to monitor blood pressure.
Excess growth hormone. Excess growth hormone is produced by the anterior pituitary gland after the epithelial state closure has occurred. Pituitary adenoma is a benign tumor of the pituitary gland. Other tumors can cause from the lungs, the pancreas, and the adrenal glands. Acromegalia is giantism, and it affects adults in middle age. It results in large hands and feet, thick lips, coarse facial features, protruding forehead and jaw, widely spaced teeth, and swelling of internal organs, such as the heart. Signs and symptoms of growth excess hormone in children are increased linear growth, which can be associated with obesity, with their increased head size and prominent forehead. Other signs and symptoms include, for adults, headaches and stool expansion, numbness or burning of the hands and feet, glucose intolerance, cardiac dysfunction, high blood pressure, goiter thyroid and large thyroid glands, sleep apnea, tiredness, menstrual disorders, decreased libido, ocular distension, and depression and/or anxiety. Diagnosis of growth excess hormone includes blood screening, oral glucose tolerance testing, MRI to determine if tumors are present in the pituitary and the hypothalamus, But if one test confirms excess growth hormone and the MRI shows no signs of tumor, then further testing is needed to determine if other tumors are present in the body. It can be difficult to screen early stages until physical signs are present. And you can see in the picture, those are actually the same baseball players, and they all have been noted for having used steroids. Treatment of growth excess hormone includes to reduce the growth hormone production, medication, and surgery to remove tumors via the nasal cavity to reach the pituitary gland, incisions with a gun beneath the upper lip into the septum, the nasal cavity to reach the pituitary gland, and radiation therapy. And there's our references.